Let's talk about knee arthritis. That's why you're here, right? So either you have knee arthritis or you're treating patients with knee arthritis. And my big thing is if you've already been treating or been treated in this section, let's say it's your right knee that's painful or bothersome because of the arthritis, chances are every bit of treatment that you've had done has been to this leg. The reason that you may not be getting any better is because you're only getting treatment here. And you may have been to 4 other clinicians. You may have done 4, 5, 8 different techniques in this region and not fixing them or not fixing yourself. So let's see what happens when you take knee arthritis and you do motions on the other parts of the body, the leg, the arms, and the trunk. What you'll notice is it works pretty fast. You don't have to wait 2 weeks for it, all right, to gradually see it work. We like to show you things that work now, which means those are the things you should do until it's all the way healed. So let's get right to it. Knee arthritis typically hurts doing weight-bearing activities, for example, like a step. And so if you don't have a step, go to stairs and step up and see what that feels like. Now, some of you stepping up, maybe it's not high enough and you need a higher step. Maybe you need a little bit more, something that's a little bit more difficult and challenging. So going backwards may be the thing that bugs you into that knee. Maybe you've got to go down to a deeper squat to feel it. Whatever it is, you're going to test it right side versus left side and find out which one bugs you, all right? Which one of the exercises bugs you. So let's just say you say the step up really bugs you, just a regular step up. But on the other side, it feels fine. Now, if one feels yucky and the other one kind of feels kind of funky, that's not the exercise you're going to use to fix it. You could just go to other body parts. So let's just say this one hurts. And you say, we don't use a scale of 1 to 10. We use 1 to 100. The higher the number, the worse it is. If I go, and don't worry about it, it's just a score that we use. If I said to you, how hard, yucky, painful, all of it wrapped up together, how hard is it? All right. And you may say, well, when I did that one, it's like a 60. Cool. No big deal. And this one feels good, right? They say, yep, feels good. All right. The quickest and easiest thing that I can give you is this one hurts doing that. This one doesn't hurt doing that. If you want to try it, just go straight to this leg and do reps of, I don't know, 15 to 20. Maybe this is really easy, so you don't even, maybe you'll do 30. We're going to do 2 sets, so don't exhaust yourself. All right, so notice I could bring that leg down, but I just like to do it like this. If you wanted to come down, you could, but all right. I'm going to do 1 set. I want you guys to do 2. There's a reason behind it because usually just doing 1 set when you're hurt doesn't show enough improvement. So let's just say I've done 20. I'm going to stop. When I get done, I'm going to do another. How long do I have to rest? 15, 30 seconds maybe? I don't know how conditioned or deconditioned you are. So if you have to do it, wait longer, that's fine. But when you're ready, do another set. Right? Another set of 15 to 20. If you can't get that many, get as many as you can without exhausting yourself. I like to tell people, do as many as you want, that you know that when you have to do another set, you won't mind doing them. So that means I don't want to exhaust you because then you won't want to do another set. Okay, let's say that's 20 for me. I will then, remember I called it a 60. And I'm just going to come on and go, whoa, that's better. Your speed will get better, right? The pain should drop. All right, now some people, they get a higher stool. Let's say it was a squat they're doing, right? And now, instead of just doing this little squat before the pain comes on, they're able to go all the way down here, but now they have the same pain. But they got this much more motion. That means it's better. So let's just say you went from a 60 to a 30. You got 50% improvement. Okay. Do it again. 2 more sets. And you're going to keep doing 2 more sets. All right, so you're going to do 2 more sets, retest. Do 2 more sets, retest. We're trying to get you all the way down to a 5 or less. If just doing it this way gets you to a 5 or less, you're done for that session. If it doesn't, what I would like you to do is to go to another body part. Now, if you've seen enough of my videos, you'll see the majority of the time I'm showing people something in the legs, something in the trunk, and something in the arms. Oftentimes, it's the exact same 3 motions I'm doing, no matter what condition somebody comes in for. But that's how powerful these 3 are, starting off with just anything. Okay? So the next thing is twisting. Now, I'm sitting here because I happen to be standing, and this is by me. I could do it from the chair. All right, but wherever you are, just go ahead and twist. Feel what it feels like. And you'll notice twisting from a chair versus here versus standing, you might have a different side that's the harder one. So this one's easy, feels normal. This one's a little tight, maybe a 15. It's okay, all right? I'm wanting any good motion anywhere in the body to try to fix that leg. How many of you believe the whole body's connected? We all do, right? Well, if we can get rid of the restrictions in our body, and I'm showing you basic level restrictions, many of you from this basic level restriction routine will feel at least a 50% or more improvement in your knee. Okay? It's pretty cool just by something you're watching off YouTube, right? So go ahead and find it. You go, yeah, about a 15 or 20. Because I said a 15 or 20, I'm going to call it a 20. I just used the higher number. I am now going to twist for 2 sets of 20 to the good side. Okay, I'm going to do 1 set. All right, I'm going to do less of them just to sake of time. You can stop the video at any time and do this. And so let's just say that is 20 for me. Okay, if you're deconditioned, you can do less than 20, but let's say that's it. I rest as long as I need to, usually 15 to 30 seconds, sometimes a minute, but usually twist is pretty easy. So I start it again. I don't want anything bugging me. I don't want to sit up too tall. All right, I want you to be in the most comfortable position. Maybe a slouch is more comfortable. Whatever it is, the most comfortable position. If you want to put a leg out or something, that's fine. There's no real rules on this. So you're going to do sets of 20 if you can. Okay, if you can't, just lower the number. Let's say I've done 20. I'm then going to come over and I'm going to recheck the tight one over here. Whoa, actually it really did get better. It was a little tight. Feels a lot better. So that 20, I'm going to say is now a 0. And I'm going to now recheck this, which let's just say had been stated at 30. And I'm going to come up and I'm going to go, whoa. Right? Or maybe it stays the same, but let's say it dropped to 15. So now I've gone all the way from a 60 to a 15. I've done 2 exercises. Keep doing this until there's no longer an improvement. We like to do 2 body areas per session, and that's it. However, if you finish it and it's all better in 1, awesome. What do you do for homework? The same exact thing. You're going to notice that your 60 next time maybe only starts at a 30 because you're going to go throughout the day maybe, and maybe you bug it. I'm going to show you how to, well, anyways, so that's how you treat it, is just go do these things again. And let's just say you didn't do the arm, right? The next one is we haven't done an arm one. So we check arm here and we go, this is a little low. Maybe they both feel really good, okay? Maybe an exercise you go, I can't tell a difference. I go, okay, well, if you had to do 1,000 of these versus 1,000 of these, okay, this one's a little tighter, so it's less gooder of the good. So this feels really good. So I'm going to start with this left one, all right? And I'm going to do my sets of 20, and I lift up from my ribs back, all right, up, back, okay? I do 20 of them, I rest, and I do another 20. Okay, so let's just say I've done 2 sets of 20, and now I'm going to recheck my leg. And let's say this is my second session of the day. All right, so I had tested to begin with, and they said starting at a 60 is a 40. And I go, all right, well, I'm going to see what arms do to me now. And I go, oh my gosh, that took my 40 right down to a 10. Keep doing it till you do 2 more sets, recheck it. Pretty cool, huh? Pretty simple, huh? Now, that's what you do for like homework, but how often do you do the homework? check it out. After you've done the initial one and gotten yourself better, about every hour or two, just check going up steps and see if it's gotten worse at all. If it has, you'll want to treat. But let's just say you go, yeah, it's not too bad. It went from a 0 or a 5 up to a 20. I don't really have time to treat yet. Okay, check out in another hour to see if it's getting worse. And so let's say you check out another hour now, instead of being a 20, it's a 40. Well, if you keep going without treating it, it's going to be a problem. And it's going to get you into chronic pain. So you'll say, all right, I need to take the time to treat myself. So go ahead and treat something in the leg, something in the trunk, something in the arms. You don't have to do all three, just two of them. And again, don't always start with the leg. Start with the trunk and see. Because you might find a trunk gets rid of the thing really quickly. So you do that, and you're done. 2 hours later, check it again. And you may begin noticing that, hey, Tom, I am now, instead of just lasting 2 hours before I have pain, I'm lasting 6 hours before things have changed. That means you're healing. Good? And maybe now you're ready to challenge it even more and you do a higher step. Or you go and you go backwards and you go, oh boy, that gives it to me. And all you got to do is to find other motions that keep bugging that knee. And again, you can still use the same motions that you're still finding, or you can change it to other motions in the trunk and other motions maybe out to the side in your arms. And that, again, down below is called totalmotionrelease.com, basically for clinicians. And it's outsmartpain.com for general public, all powered by the same technique, all used the same way. And what we then, if you go to those websites, I'll show you videos of me treating a lot of different conditions, most of them still with these three motions. And then in our training, we show you how to get these restrictions, how to find deeper and deeper levels of restrictions in your body that'll cause these things to stay gone even longer, all right? Maybe improve you faster and give you the tools that anytime you have pain anywhere in your body, you can now use this for the rest of your life. You clinicians, you too will be able to teach this so that you're giving it to patients. They'll be so good at it, they'll be able to tell it to their friends and family too. It's a lot of fun. The thing is here, the biggest obstacle that will get in your head and in your way is because for your entire life, you've always thought, if I have knee pain, I need to treat somewhere on this side where the knee pain is. And we have ignored, as a culture and as professionals, the other parts of the body that do work. We haven't used those to fix what doesn't work. Now you'll know better and you'll be able to. But, for example, I used to do a twist just like this, and I always thought that's the way you got to do a twist. And it took me 2 years to figure out. I thought I always had to be upright, and then I found out that slouching even did better for some and not for others. And I found out if you were more comfortable, and we've learned things that said, oh my gosh, my old way of thinking, hey, when you do something, you got to be in proper posture. Yeah, I'll teach you about proper posture because it's not what you think it is. It's not what they tell you it is. All right, there are things that you're doing in life. We call them life activities or life skills that you're doing that's actually causing that pain, that knee pain to stay worse, that knee arthritis to get worse. And as long as you keep bone on bone and crunching on them, it's going to continue to get worse. I had a doctor, a surgeon, that every time he played golf, he could hear his knees crackling. His buddies could too. And I taught him the arm raise. The arm raise was his very best one. And when he did it, his pain hurt the most going down his step. When we taught him to do this, and it would literally get rid of, he had some creaky knees. He'd go, Tom, this is so cool, but how am I supposed to tell my other surgeon buddies that I'm fixing my knees doing an arm? And again, remember we said the whole body's connected, isn't it? So why aren't we using an arm to fix a leg? And if you don't know it already, the positions you move into, that's why we treat left versus right, is telling you, I like this, I don't like that, right? By the degree of comfort. Easy. So each time we go into restriction, there are 7 out of 9 times the body's tissue, or 7 out of 9 tissues in the body like to go into comfort to heal. All right. 2 times out of 9, they like to go into restriction. So why wouldn't we start already in things that move well to fix what don't move well? And 2 out of 9 times use what doesn't feel well. We have it flipped around in traditional therapy. And the thing is, we only stay in one quadrant of the body. That's a big problem too, right? As soon as you start using all 4 quadrants, which really, if you spread out like this, the quadrant is from here all the way up, right? Includes the neck and stuff. This quadrant over here. You got this quadrant over here, which is let's say lower back, pelvis, and leg. Lower back, pelvis, and leg. You'll begin seeing, oh my gosh, this makes so much more sense than what we're currently doing in healthcare, and we need your help getting it out there. So if you love what you're seeing, hit subscribe. If you got used to watching this on YouTube, and again, click the buttons down below and learn even more about this. And thanks for giving me a little bit of your time today. And please make comments and tell me how it worked. And if you need a little help, make a comment there too, and I'll do my best to help.